Namaste and good afternoon. This is Dr. Srinidhi Chidambaram, and I'm very happy to see all of you again. I'm delighted to welcome you to the Freedom from Diseases series presented by Apollo Hospitals, in which the best of our specialists will be explaining to you about what's new in medicine, what the latest innovations and cutting-edge treatments are, and what you need to be aware of so that you get freedom from diseases and conditions and live a very healthy and joyful life. Today, we're going to discuss a very, very common health issue that many have, which is obesity. Obesity is as big a pandemic today as COVID, or even more, one might say. WHO stats do show that worldwide obesity since 1975 has nearly tripled. And in 2016, there were more than 1.9 billion adults 18 years and older who were overweight, and over 650 million were obese. And the sad thing is that 39 million children under the age of 5 were found overweight or obese in as late as 2020. So obesity is a pandemic and it has catastrophic effects on the body. It's not just a cosmetic thing, but it does affect every organ in the body and adds strain to also your bones and joints. It increases inflammation in the body. It is even known to be a risk factor for cancer and even for type 2 diabetes. And it has been linked to a multiple number of conditions, including heart disease or high blood pressure, certain cancers, stroke, gallbladder disease, fatty liver disease, name it, it's all there. So obesity is something that cannot be ignored, and it needs to be addressed at the earliest by all of us. But the good news is that obesity is reversible and obesity is treatable. As you all know, the body mass index is the calculation that takes a person's height and weight into account to measure the obesity. And there are certain categories of obesity where when the BMI is over 40, we call it as morbid obesity or very severe obesity. And in such cases, it is probably not enough to just have the diet and lifestyle measures. And in order to prevent life-threatening complications and diseases, bariatric surgery is needed. It is almost life-saving in severe and morbid obesity. And when you have serious health problems because of your excess weight. There are many procedures now, and they have different types of functions. They address the obesity in different ways, as doctor would tell us today. There is also a lot of misconceptions, and awareness is lacking when it comes to bariatric surgery. And today's session is specially focused on clarifying these. To enlighten us, I am delighted and honored to welcome Dr. Raj Palaniappan, who is the head of the Institute of Bariatric Surgery from Apollo Hospitals, Chennai. Dr. Raj Palaniappan is really a very well-known bariatric surgeon who needs no introduction. And he has had the distinction of performing almost all types of laparoscopic surgeries, qualified with an MS from the Ramachandra University, India, Chennai. He also has other qualifications like the MMAS from the Nine Wells, Dundee University in the UK, FICS from the International College of Surgeons, USA, the DMAS, the Global Open University, India, and many such qualifications. And he has done his super specialization in laparoscopy in the UK and also has worked under the doyens of laparoscopic and bariatric surgery, both in the UK and in the US. Completed his surgical gastroenterology and robotic fellowships as well from the US. He worked in many teaching institutes and hospitals in the country, and then is now part of the Apollo Hospitals group. And he has special interest in single incision and robotic surgery and a leading specialist in these fields. He has also had the record of performing the first SILS and robotic bariatric surgeries in the country and has trained several surgeons in the field of bariatric and minimal access surgery through his trust, which is the Forum for Laparoscopic Innovative Practices of FLIP, and runs the Surgical Specialty Service Bariatric and Robotic Surgery BAROS at Apollo Hospitals, Chennai. Also started a foundation, Reclaim Life, to create awareness about obesity and to educate society about the need for lifestyle modifications. I'm delighted that you're here, Dr. Raj Palaniappan, and I look forward to you taking our viewers through the complete spectrum of obesity. If we could start by talking about obesity and its causes in brief, and then we could move on to what becomes morbid obesity and what treatment it entails. Over to you.
Okay. Thank you so much, Dr. Srinidhi, for an elaborate profiling of mine. And namaste to everybody around the globe who are interested to learn more about obesity and bariatric surgery. So the primary thing about obesity, what we are worried about right now, is because it's become such a pandemic situation. It's causing havoc around the globe, especially with the economy, with the health, and with the social standards in every possible way. And that is the reason why WHO has already named it as a disease beyond a stage. That's as you have said, beyond 40 BMI. That is, if a male becomes more than 40 kilos overweight or a female becomes 35 kilos overweight than their ideal weight, we call these people morbidly obese. So the issues what they get along with the morbid obesities are plenty, starting from psychological effect like depression and not able to concentrate much on their professional, especially when they are in the young age, when they are studying in the colleges and schools, to not able to concentrate and perform well in their work as well. So that gives a very big psychological downside to their life. Apart from that, there are certain diseases which are really troublesome to their quality of life. The most common, as you said, is the diabetes, hypertension, and dyslipidemia, called as the metabolic syndrome X. Then infertility is one of the biggest menace in the 21st century, especially 30% of women are facing it, and more than 80% of women who are obese will face it. Polycystic ovarian disease also is one of the reasons. Again, obesity causes polycystic ovarian disease and infertility, which needs some treatment. And there are times when women go through 3, 4 cycles and are not able to get their pregnancy back in track. When those kind of people with morbid obesity, they need to address obesity as well. Then the next problem is called sleep apnea. Obstructive sleep apnea is a condition which not much of a people will know about it. So it is one of the 30% reason of a silent heart attack in most of the people. When they are obese, they have a lot of problem with the breathing difficulty, oxygen concentration goes down. So the body cells doesn't have enough oxygen. So lethargy, weakness, and heart has to pounce more. So it overacts, and at one point of time that give up, and that causes a silent heart attack in this patient as well. Then again, mechanical problems like arthritis, needing knee replacements, all kind of things. And of course, as you said, gastrointestinal trouble like few cancers, gallstones, and non-alcoholic liver disease, which can even cause liver failure in certain patients, respiratory failure in certain patients. So these are all various problems which comes with age. So our aim is basically to make sure that morbid obesity has been reduced to severe or normal obesity or moderate obesity. If they are moderately obese, not to make sure that they go into severe obesity or morbid obesity. Basically, to make sure that they are within maximum of 10 kilos within their normal range. So their quality of life improves and their life expectancy is also better with these kind of a patients. So that is where the science of bariatric surgery has come into picture, where we work on the surgical options for morbid obese patients, medical options, and endoscopic options for moderate to severe obese patients. And of course, certain patients need only lifestyle changes, where we make sure that these patients guaranteed a good quality of life.
So, there are several questions, of course, about obesity, and we will look at some of them a little later. But could we talk about the causes of obesity a bit as to, like, can somebody not help, being obese? Is it something in their family, or is it something that can be prevented?
So we basically divide that causes into 4 major groups. One group which is very particular about their genetical nature. So they are born with the genes that will help them not to have too much of a metabolism, so that they don't spend much of the calories what they take by nature itself. There are few group of people who commonly are born with that. And what happens with them is the metabolism goes down. So whatever calorie they take, most of them are saved, and slowly they start gaining weight. There are some 203 genes which are responsible for this, which is one. Second is hormonal issues, especially in women when they attain menarche, when the hormonal issues started happening, when the periods are not enough because of the progesterone estrogen complex issues, they tend to put on weight. And it becomes a vicious cycle that leads to obesity, water retention, and again it leads to severe PCOS. So it becomes a vicious cycle for those people. And of course, young guys who doesn't have much of an activity and indoors with so much of games around. So these girls and boys don't play much around, always indoors, having a lot of junk food, all those things, poor lifestyle makes them obese very early. Once you become obese as an pediatric age group, 90% chance you are obese as an adult. The third is the diet factor. I put diet factor the third. People all think that diet is the most important reason for obesity. Unfortunately, that is not. So you cannot blame everybody for their diet when they put on weight. So the diet part comes pretty later, where you eat more calories than what you spend. There are 20% of the population only have a diet issue as an issue of obesity. Rest 80% have other reasons, either genetical or a hormonal reason, or the fourth reason will be because of some kind of diseases or injuries or medications requiring steroids and other therapies where they put on weight. That also again is not in their hands. So out of four main causes, we always say only one is in your hand, that is the diet pattern. And of course we say a good diet and a good exercise will always help. Yes, will always help. So we'll categorize this into four: genetic, hormonal, lifestyle, and diet. So with all these four together, we analyze how the patient is can be treated once the obesity cause is identified.
So you were talking about the genetic part. So do we actually find out whether that person is genetically predisposed to obesity before treating them?
Okay, so the genetic predisposition cannot be seriously identified by the gene identification, but however, we will identify by what we call as a body composition analysis, where their muscle mass, their fat mass, their metabolism, their waist hip ratio are analyzed, and we'll come to a prediction that this can be because of the genetical nature if the hormones and the diet side are normal. So a detailed history will give us an idea, because these gene mutations cannot be really identified except for one or two genes. So we will not do any gene identifications sequence here. We work only on the other parts and then eliminate the other reasons to get into genetical nature.
Right. Before we go on to the morbid obesity, let's also talk a little bit about what you briefly mentioned now, which is the childhood obesity. Now, that is becoming a big problem, and it has been exacerbated, as we all know, because of the pandemic. When children are at home, they are not having a routine. There is no proper, they're not even, whatever little activity in school also is not happening. So there is a good chance of boredom and stress eating. All this is suddenly, the last 2 years, they've kind of hit us on our faces. So what would your advice be to parents on what they can do? Because sometimes they're quite helpless, because even the parents are bored, and they also stress eat, and everybody puts on weight, and it becomes something like a comfort. Sometimes you feel a lot of comfort when you eat your favorite foods. So how does one kind of particularly look at childhood obesity and try to prevent it?
Yeah. See, I would like to see that very seriously, because with the present childhood obesity, we are in a danger of getting into more than 50% of our population becoming obese 30 years later, because that is what a very alarming situation.
Yeah.
And
Yes.
what happens with child obesity is, as a growing up child, in earlier first 6 years to 8 years of their age, they need to have a lot of calories to help their all the organs to grow well. Yes, that's perfectly fine. That's why they say that baby fat will go off later. But when you come into a teenage where the maturation part happens, that is when a lot of parents should be very careful. So when the maturation of the body happens, especially bone maturation, organ maturation happens, the hormones should secrete normally. So for that to happen, you need to have a good amount of physical activity, a balanced diet with high protein, because Indians are much more less prone to absorb protein than the Westerners. We have 20% deficiency of protein than the Westerners. So we tend to have less muscle. So more proteinaceous meal, a less carbohydrate, and a normal fatty meal. So we will say 50% of protein, 25% carbs, and 25% fat in a meal. Kind of a balanced meal is important. Physical activity is important. They should not be obese, because the maturation on the hormone and the organ maturation will not happen. This may lead to PCOD in women, as well as prolonged and delayed cognitive and bone growth in both men and women. And that is when their concentration goes down, their performance goes down, and they become below average or an average adult, because their formative years are not great. So it is not just about the way they look, it's about the mind not growing well. They are not able to have a good concentration. And of course, they become weaker when they turn 40, 50s easily. So for these reasons, the most
Not,
important thing is to make sure
not
that they eat well, they act very active, give some kind of a lifestyle modification which is very predictive and very fixed until they become teens.
absolutely. So now we will go on to the types of the grades of obesity, really, and where does your specialty come in? Because there's a lot of confusion as to who needs this kind of intervention and who can uh, lose weight without this. So who needs it and what is it all about?
Yeah. So, for example, when you start putting on weight than your ideal weight. So, as you said, mentioned it before, we take a BMI to understand what is your ideal weight. So, for somebody who is of my height, I'm 5'10", my ideal weight has to be 72 maximum. So, if I start putting on weight until 8 to 10 kilos, that is when we call this overweight. Overweight is a perfectly normal situation where there is no change in the hormones, no change in any metabolism. So, if at all you control your diet and exercise properly with a change in lifestyle, we lose 100% of our weight. The moment you cross that 8 to 10 kilos, that is when you call it obesity. That is the BMI from 18 to 25, we call this normal. Beyond 25, we call these people obese. From 25 to 35, 32.5, what we call as moderate obesity, where the issue is the patient will be around 10 to 15 kilos to 18 kilos overweight, where the metabolism alone comes down. When the metabolism comes down, you have to put that much more effort to lose weight. So there is a 70% possibility of people losing weight by diet, exercise. So we will give diet, exercise to those kind of people and lifestyle changes. So they will lose 70% of times. Rest 30% will go into severe obesity category, or they need medications to boost their weight loss by increasing the metabolism and decreasing the hunger and all those kind of hormones. Or if they get into beyond 20 kilos into 30 kilos, where they get into severe obesity until 32.5 to 40 or 35 to 40 BMI, where the hormonal changes started happening. So periods problem will be for women. Men will be having thyroid issues, or sometimes women also will have thyroid issues. And of course, you'll be sedentary, you'll be not be very active. In those phases, only 30% chance of you losing weight by diet, exercise. So medicine is a must in this plan. Or if medicine also doesn't work because the body has set itself into a different range of weight, it will not allow you to lose beyond that. That is when we will have something called endoscopic techniques, where we put a balloon inside, or where we reduce the size of a stomach You will add more medicines and all those things, fat burners and all those things. We also go to VLCCE and other clinics to loosen reduce the weight by electrical and other mechanical ways. Once you cross 40 BMI, that is more than 40 for a man and 35 for a woman, what happens is the hormones are so suppressed, the organs started failing. So you start having diabetes, hypertension, cholesterol. If a family history of these diseases are there, even in severe obesity, these people can get the disease. But otherwise, once you cross into morbid obesity, the disease process starts. That reduces your quality of life. That is where 40 BMI and above, we call these people a diseased individual and not just overweight alone. And that is where bariatric surgery and metabolic surgery comes into picture, where if the patient fails medicine, patient fails lifestyle changes for a minimum of a 6 months period of time, then we'll recommend bariatric surgery for these kind of a patients to improve their quality of life and improve their health by reducing the resolution of the diseases.
So coming to the different types of bariatric surgery, could you now tell us what are the types of bariatric surgery and a little bit about each one of them?
So when it comes to bariatric surgery, we have two main concepts. One concept is to reduce the amount of food intake. This will help people who are volume eaters, who eat voraciously. So we choose this type of a technique, otherwise called as a restrictive bariatric surgery. Typical example is a balloon, a band, and a sleeve gastrectomy or stomach stapling. These procedures are done for volume eaters and young individuals because once you reduce size of a stomach, they will be eating less and this volume comes down. So naturally, with some kind of a physical activity, they will lose weight. Apart from this, because of the reduction in the volume, there is one more hormone called ghrelin which is removed from the body, which is responsible for hunger and control of certain hormones that is not there. So invariably, it will give much more metabolism and reduce certain hormonal issues, and we will get a weight dependent relief from diseases. There are next group of surgery called as metabolic surgeries or malabsorptive surgeries, where we reduce the absorption as well. So one is restriction, other one is restriction plus malabsorption. So even if you eat more, the body will absorb only less amount. The rest comes out in the motion. So for this kind of a procedure to be done, you need to be very, very big, 40, 50 kilos overweight, or you need to have certain diseases like sugar, BP, and cholesterol, where these diseases also will be resolved or sometimes cured as well because of the hormonal changes what this absorption deficiency brings in. So we pool these two techniques. The main procedures in the bypass are all the bypasses comes under the malabsorptive procedure, like a Roux-en-Y gastric bypass, one anastomotic gastric bypass, duodenal bypass, single anastomotic sleeve jejunostomy and ileostomy, duodenal ileostomy. So much procedures there. How we choose each and every procedure is a restrictive procedure has least of nutritional deficiencies, which is very common after every bariatric. So a patient needing more nutrition for their growth, especially young individuals who need energy for their life, we will choose a restrictive procedure. Whereas if you come into middle age group, where you already are deficiency, so you will be having calcium tablet, you will have B12 injection, you will have some iron tablets. Those kind of peoples, any which ways are having deficiency because of issues. You do a metabolic procedure or a malabsorptive procedure, a bypass, and give them a supplement for a long time with multivitamins. So they lose weight for a longer duration. They lose their sugar, BP, cholesterol, and all those things. So a bypass procedures basically are done for middle age and other and old age people where there is a disease process, and a restrictive procedure for a younger individual. And type of bypass will be decided depending upon what kind of a deficiency each has and how much weight loss has to be done.
So, what are the benefits really of these different types of procedures? Like, when can they see the effects of weight loss?
So the weight loss starts immediately. So when you do a restrictive procedure or the sleeve gastrectomy or the balloon or band, the weight loss is also good, but the problem is the resolution of diseases are weight dependent. When the weight loss goes down, the disease process goes down. But they have a 20% chance of weight regain after 4-5 years, when the disease process might come back also when they regain the weight. Whereas if you do a bypass procedure, the weight loss will be around 80% to 90%. Resolution of the diseases is weight independent. Whether you lose weight or not, immediately. We have patients who are diabetic, who doesn't need medication the day after surgery, who are hypertensive, who doesn't need the medicine the day after surgery. Or it can take up to 6 to 8 weeks for the resolution to happen. Some people can extend up to 3 months. So all in all, weight loss will happen for a period of 1 year to 1.5 years, between 70 and 80% of all the excess weight. Resolution of comorbidities between immediate to until 3 months of their life, the resolution of comorbidities happen. So this way, you're disease free. Sometimes if you within a year's time you reduce all the weight, you don't have sugar, you don't have BP, you don't have cholesterol, you don't have heart issues for 80%. All these things can come up, become all right within 3 months time itself.
So, what are the side effects of these surgeries? Because from what we see when we talk to people, the moment we say bariatric surgery, there is a lot of fear because they feel that it is a serious surgery. It's not something which should be taken lightly. So, what would you like to say to such people? What are the risk factors? What can go wrong?
So I call bariatric surgery as a page 3 surgery. So anything that happens in bariatrics, it becomes news. To be frank, bariatric surgery has one of the least complications in the entire gastrointestinal surgical spectrum. As per gastrointestinal disease index, a normal 11.1% to 22% complication is accepted, whereas bariatric has 8.1% complication. A mortality of 1% is accepted, bariatric has 0.4% mortality. So, of all the gastrointestinal disease surgeries, bariatric surgery is the least of all this issue. But unfortunately, as I told you, because of the celebrity status it holds, everything is built up out of proportion. But when it comes to side effects, the commonest side effects what people face is a nutritional deficiency. So because of nutrient deficiency, especially B12, iron, calcium, and protein, you have weakness, you have some sagging skin, you have dry skin, so you look weaker. If the multivitamin replacement is properly done, you will not have this kind of issue at all. Unfortunately, a lot of patients doesn't follow that, or they are not aware because doctors wouldn't have told them. This is a major issue what puts them down. Second is the lifestyle issues. They can't eat much, so they try to overeat, they vomit. Once they vomit, it becomes a social stigma, so they're scared to go out. So these kind of issues, and they eat very small frequent meals. Everybody will complain about their eating habits, so it becomes social stigma as well. So that's a lifestyle changes sometimes can be big, which can be a side effect as well. But there are some surgical side effects like leak. If you do a wrong technique, if the suturing is not done well, a leak, a stricture, and a bleeding can be life threatening if not done in the right technique is done. So right technique is very, very important to avoid these kind of complications. And of course, respiratory complications. Already these people have sleep apnea. So respiratory problems, post-operative recovery will not be ideal. If the preparation is not done, this patient get respiratory depression, and we might sometimes be having ICU admissions and other issues as well. When it comes to long term, nutrition is one. The next important thing is obstruction, internal hernia, reflex diseases can all be a part of these kind of complications. As I told you before, the right technique, the right choice of procedure, and proper follow-up of nutrition, you will have a 95% near normal life as any other normal individual.
I think that's very important to know because, as you yourself said, uh, uh, more than any other surgery, I think it is the bariatric surgery which has a slightly, it is considered by many people as something maybe which is strictly not necessary But I think they need to understand that it is necessary in cases of morbid obesity, and it's not something that is just done for external, and there is also sometimes, many people ask me this. They don't understand the difference between a cosmetic liposuction kind of surgery and a bariatric surgery. So maybe you could explain what exactly they both are. They're quite different, and they are these are all not vanity surgeries, these bariatric surgeries, whereas liposuction, and there are so many other cosmetic surgeries which are merely designed to improve the aesthetic appearance.
So we call bariatric surgery as a gastrointestinal surgery. All the cosmetic surgery as body contouring surgeries. So the cosmetic surgery is to shape your body, doesn't do anything, it doesn't have anything to do with weight loss. So you remove the fat, you remove the 2 kgs of tissue out, but the body will reform that and you will again gain weight. So they only reform the shape of the body. So it's called body contouring. Whereas bariatric surgery, what they do is goes basically at the root level of reduced absorption of calories, reduced intake of calories, and increasing the hormone secretions as well as increasing the metabolism. So they work at 3-4 different levels to lose weight. So it is a part of internal part surgery, whereas cosmetic is external, just a fat removal surgery. Again, the cosmetic surgery has to be done multiple times to achieve some kind of a weight loss of 4 to 6 kilos in a lifetime. Whereas bariatrics, one surgery will help you up to 100-105 kilos also in patients who needs the weight loss. So the guaranteed resolution of comorbidities and quality of life is there in bariatric surgery, which is a gastrointestinal surgery against the cosmetic surgery, which is all tummy tuck, liposuction, and all those, and arm tuck and all those things.
So is bariatric surgery also something that can be redone if there is, there is a weight regain?
Okay, so the scenario is this, and none of the weight loss procedures, including bariatric surgery, is a permanent solution. Whereas the all other modes are short term, bariatric surgery is a long term. Long term means there are studies about 30 to 40 years of patient maintaining their weight, but only 80% of them, rest 20%, still they gain weight. If the technique is done right, if the procedure of choice is done right way, if the patient follows up the protocols well, then they fall into the 80% category. Otherwise, they can fall in the 20% category. These 20% of people, when they gain weight, if they gain beyond 30% of their excess weight, so if they lost 50 kilos, they gained 20 kilos, then the disease process might come back again. When the disease process comes back again, when they are not able to control their weight gain, regain in spite of doing other measures, then we look into a revision bariatric surgery to increase the what we call the power of surgery. So if we made sure that patient loses 40-50 kilos for the first time, we will tweak it to lose some more, another 20 kilos in the second time. So revision bariatric surgery is done in those people where the life can be threatened if they gain weight again. So only about 2 to 3% of post-bariatric patients might need a revision bariatric surgery. But of course, this is available when the patient regains the weight.
What is metabolic surgery, doctor? We keep hearing this word quite often these days.
So metabolic surgery is a classical type of an alternative type of a bariatric surgery where the patient is not morbidly obese. You are only 15 kilos, 20 kilos overweight, where you don't fit into the metabolic bariatric surgery fold. However, you have diabetes which is uncontrolled. You have cardiac issues where you have had a heart attack. You have valve issues. You have vessel issues where you have angioplasty done. You have a severe knee problem. You're not able to walk around well. When you have these kind of issues, when there are life-threatening and diabetic nephropathy, diabetic retinopathy, when you have complications because of diabetes, sleep apnea, or you have complication because of cardiac issues and you are not that overweight. We do these surgeries to improve the quality of life and resolve the diseases. Weight loss will be 5-6 kilos. So weight loss is a byproduct. But resolution of these comorbidities, these three main, sleep apnea, diabetes, and cardiac issues, resolution as a primary aim, because otherwise the patient might having a life-threatening scenario. This is called metabolic surgery. So wherever the patient is not very obese as per guidelines, but still operation done for these scenarios, that is what we call metabolic surgery. It has been increasing of late. Before it's only bariatric surgery we are doing. Now 25% of all our patients are metabolic surgery patients.
So now we'll take some questions from our viewers. So this is mostly about obesity as such. So one thing is about people, what kind of diets should they follow? Because today there is an overload of information in social media and everywhere. So there are different types. There are people who say you must have high fat and no carb. Some people say that you should have a balanced diet of all. Some would say that you need to hike up your protein, whereas some would say eat only once a day, some will say eat every 2 hours. So there is a lot of confusion as to how you can actually lose weight, or does it depend on each person? So could you give us your views about it?
So when it comes to Indian population, the diet pattern has to be decided on two factors. One is what we call thrifty gene hypothesis. Indians are genetically poor in their previous generations until last 50-60 years. So we used to have only 1 or 2 meal a day. So our diet was predominantly carbohydrate based diet at that time because of sparsity of the food what you're getting. So you eat a very high carbohydrate meal in the morning and a very carbohydrate meal in the night. In between will be only kanjis and other stuffs, all those kind of stuff, because we are poor country those days. So our genetics has made us that way. So what happens now? We have 3 to 5 meal a day with a good calories. So everything what we eat is absorbed by the body and stored inside. That is why we are prone for obesity and diseases much more than the Western population. So point number one is try to go back to either small frequent meal or intermittent fasting. You lose weight for the Indian population. Okay. Second way is the calorie intake. The more calorie you take in, the more you absorb Indians. And we are deficient in absorption of protein. And if you don't eat carbohydrates, your muscle will be burnt to take up the energy what we require. But if you eat fat more, the excess fat will not be absorbed, comes out. If you eat more carbohydrates, the excess carbohydrates is converted as fat and stored inside. So the calorie intake has to be smartly placed. Good proteins, that means high protein, to compensate for the protein deficient absorption. Low carbs, because more carbs means more storage of fat and more unnecessary. So low carb and normal fat. Fat can be more, fat can be less as well, but the less fat will cause a lot of inflammatory problems. So normal fat is good. For Indian population, high fat, high protein. 50% of the food has to be protein. Low carb, low fat, normal fat. 25% fat, 25% carbohydrates. This kind of a balanced meal and small, frequent, or intermittent fasting. Get only 2 meal a day, one snack in between. You will lose weight, or you will maintain yourself.
Also about the fact that fast food has now become a very, very common phenomenon, especially with the online delivery modes. So it's very easy to sit at home and at the drop of a hat you can order from wherever. It used to be more difficult before because you need to go somewhere or order. But what do you think about like fast food, and how do they particularly affect young people and children, and as opposed to homemade food?
So the fast food hardly contains nutrients. They are most of empty calories, so a lot of carbs and fat. So it's all starch based, so a lot of carbs and fat. they say I'm eating only chicken, but then deep fried chicken with so much of a masalas, and of course these chicken also are not farm grown chicken. These chicken are all cultivated chicken by feeding in more of steroids and more of hormones. So those kind of things are pretty much bad for our body because the body cannot absorb it well. Second thing is the body mutates itself and reduces all the hormones that is requirement for a growth and works only on storage. Another problem is this changes the bacterial growth inside the intestine. We all know that when we grew up, we learned in our biology class that uh, uh, fungus grows in agar agar. So likewise, a base is required for all organisms to grow inside the body. So we are giving a pH and a base by means of fast food in the stomach, so that we give the bacteria that will help in storing fat, reducing the inflammation, as well as giving us more and more trouble because of hormonal imbalance. When you do that, you invariably tend to like sweets, tend to like carbohydrate food, tend to like all oily food. So basically, it is not in the mind, it is in the stomach. They all say the way to a man's heart is through intestine. That is basically a norm which has been used man as a part, but to anybody, mind is through intestine means a good food make you elevated, your mood elevated. So same way, a mind eats what your intestine wants. So if at all you have become more of a sweet eater, carb eater, voracious eater, it is because of the bacteria in the body. Fast food helps this bacteria to grow. There is no prebiotic, probiotic in the body, all wrong bacteria. So that is when you are adolescent and young age itself, try to avoid these kind of fast food items, bad calories, as well as changing the bacterial growth in the intestine spoils your whole entire life. So it should be avoided no matter what.
What about maternal obesity? Does that also pose a threat to the mother and child? Yes.
That's a very interesting question, because this is very hardly been addressed, and it has been said that a mother has to be the more fatter the mother when pregnant, the better the baby is. That's a wrong, it's a myth. So a baby to be 3.5 kilos or 4 kilos weight when she's or he is born, mother needs to be only 3 to 4 kilos more than the baby. So 8 kgs of mother's weight is good enough to have a 4 kilo of a baby. But we have seen, I will say more than 70% of Indian women put on 20 kilos and more during their pregnancy. That's huge. Not less than 15 kilos. Everybody would be 15 kilos and overweight. That is basically wrong, because the olden days when there was no food, they fed the pregnant mothers more. Now what happens is too much of a calories will only be stored inside. That will give lots of problems from the hormonal imbalance, causing the the baby's growth of the brain, growth of the organs to deficiencies when they are born. 70% of children born out of obese mother will become obese in their young growing phase, in the neonatal and the first few years of their life. That can lead to some hormonal problems, sugar and BP also later, and cognitive impairment as well. Second issue is delivery also. It becomes more of a cesarean section in these mothers than a normal delivery, and these women will have to suffer much more than a normal. The more the normal delivery, the more the good is for the mother and the baby. So we tend to have a big head of a baby, not able to have a normal delivery, or cord around the neck kind of a scenarios, and pelvic thrust is not good enough for the mother. Mother develops a hernia during the pregnancy. So many issues happen. So mothers should not put on more than 8 kilos during their pregnancy by means of a balanced diet, a typical Indian balanced diet. As I always said, 50% protein, 25% carbohydrate, 25% fat. You will be a perfect mother, and the baby is a perfect baby. So be careful about it.
On that very positive note, thank you so much, Dr. Raj, for this wonderful discussion. And viewers, you know that you can always put in your further clarifications and comments on our Facebook page, and also send us messages on Facebook Messenger. Also subscribe to our YouTube channel to get all the latest information and updates on health topics. So till we meet again, stay safe, stay healthy, and start losing that weight today. See you soon. Namaste.